All right, good morning, everyone, and welcome. We've got William H. Murray on the line, and Bill is going to be talking about security culture in the cloud. Take it away, Bill.
Thanks, Joe. Thanks for the setup. I think the analogy to the automobile is very good.
Thank you.
Last week, we talked about the trend toward outsourcing, to have things done by others that traditionally have been done by employees within the enterprise. The trend is facilitated in part by the cloud, the internet, and the incredible range of services, both fee and free, that are offered on it. I used the example of Stanford Hospital and Clinic that transferred patient data to a collection agency, only to have it posted to a public site on the internet, a gross and egregious violation of the privacy of their patients. I left you with the idea that our professional objective is to arrive at a state, a culture, in which all parties understand their roles and responsibilities and carry them out in such a way as to produce the intended results. I had decided this week that I was going to elaborate on that advice. I came up with a list of policy, technical, and legal guidance for use with outsourcing. I was going to suggest that enterprises should have a policy that spells out its risk tolerance in general and in regard to the use of outside sources in particular. It might specify which data and applications could be outsourced and which could not. For example, it might specify that the enterprise's intellectual property or personal information should not be outsourced. It might also specify insurance coverage for any risk that exceeds the specified tolerance. I plan to say that agreements should enumerate the laws, regulations, and contracts to which the parties are subject, and all standards that they had adopted. They should also spell out any limitations, such as the requirement to disclose information in response to legal service. I was going to suggest that enterprises should prefer to do business with vendors that were part of such organizations as the Cloud Security Alliance and the Cloud Auditing Data Federation. I would have suggested that using enterprises might want to participate in the Cloud Standards Customer Council. I would have stressed that your contract should provide for audit or for a service auditor report. I would have cautioned you about the limitations of service auditor reports. For example, that they are limited to controls asserted by the auditee and that they are as of the time of the audit. I plan to suggest that agreements should be service by service and application by application. I intended to suggest that agreements should enumerate all existing controls, who is to operate them under what conditions, that the agreement should spell out the intended use of the controls as well as what record the use of the controls would produce. Examples of such controls, of course, include identification, authentication, access control, encryption, administration, provisioning, confirmations, messages, alerts, alarms, measurements, and reports. I would have emphasized the importance of provisioning controls in the cloud and pointed out that compromise of those controls might enable others to use services and charge them to you. I'd even plan to stress that all use of such controls result in automatic out-of-band confirmations. I would have given a caution about the error correction and vendor override controls. Fortunately, while doing my research, and before I had embarrassed myself with all of this irrelevant advice, I came across a report in the New York Times by Kevin Sack, published October 5th. Here is part of what I learned. First, there was no evil here. No recklessness, not even gross negligence, just bad judgment all around. To the extent that there was any motive, it was efficiency, just getting the job done. No greed, no lust, not even sloth. Stanford Hospital and Clinic is a 600-bed general hospital. It is not Kaiser Permanente or UPMC, but it is a major enterprise in its community. Multi-Specialties Collection Service is MSCS is a collection agency for medical services in the same market as SHC. It bills about $500,000 per year and employs somewhere between 5 and 10 people. One might call the relationship asymmetric. one-sided. The identity and the role of the sender of the information, who sent it out from the hospital, is not public, but should have required significant management discretion and rare privileges to both access and send the data. The receiver of the information was a contractor to MSCS. He often represented himself as an officer of MSCS and had an MSCS email address. Been there, done that. He decrypted the data, put it in a spreadsheet, and among other things, gave it to an applicant for a job with him. More on that. While SHC says the information was for permissible hospital billing support purposes, the consultant says it was for a study. In any case, the information was not passed in the normal course of collections, the service. I believe that both the sending and receiving of the information probably was outside the agreement between SHC and MSCS. The actual posting to the website, studentoffortune.com, was by a job applicant to the consultant. He had given the applicant the spreadsheet to convert to charts and graphics as a test of skill. The posting was a violation of Student of Fortune's terms of use, which require the user to represent and warrant that they own or have sufficient rights to post their contributions on or through the site, and B, will not post contributions that violate Student of Fortune or any other person's privacy rights, publicity rights, copyrights, or contract rights. Two things seem clear. First, everyone involved has egg on their face, except perhaps studentoffortune.com. Their terms of service, their terms of use were obvious, concise, plain, and clear. One cannot register for their site without acknowledging and agreeing to them. When the violation was called to their attention, they responded on a timely basis. I would gladly testify on their behalf. I would probably testify for a fee for or against any of the other parties. Second, none of the policy, technical, or legal measures that I wanted to recommend would have prevented the breach. If asked in advance, management might well have accepted the risk that so many controls and so many people would fail at one time. However, SHC is now the target of a $20 million class action lawsuit and will almost certainly be penalized by the regulators. MSCS has lost a major client, has closed its website, and is not answering its phone. I'm not sure that the penalties fit the crime, but they are sure getting our attention. However, to the extent that the breach impedes the urgent move to electronic health records, or even the efficient use of cloud resources, perhaps they are proportional. I like to think that my lists above are useful, if not necessary, but they are clearly not sufficient or even the place to start. No, we are back to Management and Security 101. There is no substitute for training and supervision. Outsourcing makes this even more important. Note that studentoffortune.com is typical of free or low-cost collaboration cloud services that our employees get their jobs, that help our employees get their jobs done, and are within the discretion of most of our employees. We are going through a major change in how we organize production and resources. It is being driven by the falling cost of information technology. As this new model matures, we need to evolve a culture of personal due care, one in which people automatically ask, should I do it, rather than simply, is it efficient? A culture in which people automatically consult with others before they act. Security must start with our most effective controls, training and supervision. We should focus on or use our other tools only to the extent that they are more efficient. Then we will be called professionals and be paid the big bucks.
Thanks, Bill. Certainly appreciate it. And right on point there. I got it all the way. I followed you completely with that one. Thanks. All right, everybody.